All right, welcome back to News Talk. I'm going to throw it right to Bob. This segment we're going to talk about COVID, but we're going to talk about something much more specific. We're going to talk about a country that you're not hearing much about. We did a little bit, you did some work on Brazil. We talked about that on Outbreak News today, and some of the stuff's on our Twitter page and those kind of things. Hit me up with what's going on with Yemen.
Well, Yemen, the Doctors Without Borders put out a message saying, hey, we got a serious crisis going on in Yemen. Not a big surprise. The numbers aren't really high, but this is an incredibly vulnerable population.
So let me stop. I don't mean to interrupt, but we may have somebody who doesn't know. So Yemen, a very small country on the eastern side of Africa.
It's in the Middle East.
Technically in the Middle East. Okay, yeah. So war-torn area, riddled with violence, riddled with poverty, shortages of any resources. Yeah. And I think you and I had privately talked, long before News Talk was even conceived, was what is it going to be like when COVID hits Africa, Middle East, South America, these countries that already are just, they're almost like wastelands in some of those areas where the governments and stuff have stuff and the people do not. Now it's in Yemen. Talk about the healthcare system and where we're at. Where are we on the timeline, in your opinion, and then, what's really going on?
Well, in Yemen, as you know, for the past 5+ years or so, there's been a battle, a war going on between the Iranian Houthi-backed rebels and Saudi Arabia. And the United States and Great Britain have been providing Saudi Arabia with these weapons to basically I'm not saying one side is good and one side is bad.
Those are more like the Wahhabi Muslims, if I understand it properly.
And they've just been blowing up. You have Yemen, which is this country that's incredible poverty, surrounded by all these oil-rich countries. It's just an anomaly, right? And Saudi Arabia has just been blowing up this country, and it's turned into rubble. And the healthcare infrastructure, regular infrastructure, everything is just trashed. And the health for the population is just in shambles. Malnutrition's
always been a problem
through the roof, right? And let me segue into COVID because of that. Right now, Yemen only has 900 plus COVID cases, and I suspect that's because they just don't have the infrastructure to do all this testing.
They're probably not even doing testing.
Right.
I'm shocked that we even know data into most of these places.
Right. But I assume that the testing that is being done is probably serious cases that are hospitalized.
Sure.
I doubt they have drive-throughs.
Yeah, no, definitely. I can assure you folks, if you can find a photo of a drive-through COVID testing in Yemen that we can verify, we will send you a gift from the pop culture universe of prizes. I will gladly take ownership of that photo.
I think the concern is, all right, 900 cases, there's been 250 deaths. So we got a 27% fatality rate.
That's a horrible fatality rate.
Yeah, that's huge.
So they're either testing people that they know basically have it and they're headed towards, ventilator type status based on our technology, or they're just not really doing much testing. I don't know.
Well, I suspect it's because, we know the population here in the United States that gets the most ill, right? Right. Over there, if you got millions and millions of people, no food, massive malnutrition.
Okay.
Their immune systems are trash.
Yeah, they don't have an elderly population because of the war-torn nature of the environment.
It's a very young population.
But most of the people there have so many health deficiencies and, like you said, malnutrition, immunocompromised. Is that also an area that's been ravaged by other infectious disease and things like that? Yeah.
Well, if people haven't been paying attention for the past couple of years, Yemen's gone through a massive diphtheria outbreak because they haven't been able to get vaccines. Saudi Arabia has been doing blockades around the country so they couldn't get supplies, including food and medicines and stuff. Diphtheria is something they haven't seen since like the 80s or 90s, and all of a sudden they have this outbreak. And of course, the thing that's most well known, I would suspect, is more than 2 million cholera cases since 2018, which is, for us in America, we always think back to 2010 when Haiti had the earthquake, and over a decade they had 800,000 cholera cases. This is more than doubled. It's the largest cholera outbreak in modern history.
What's the death toll from a 2 million person cholera outbreak?
Oh, it's fairly low, because if you're able to
stay
keep
hydrated.
People hydrated, people will usually survive, because it can frequently be self-limiting. So it's probably 1% to 2%.
Okay. But still a massive number in the grand scheme of things.
Yeah.
Definitely more than the 900 COVID deaths that we've already had.
Well,
Cases.
Cases, right? Yeah. So Yemen's just a mess, and it's just a really sad situation. And putting on my non-interventionist hat, I don't think the United States should be. This started with Obama, and it's continuing with Trump, and I think we should get out of that.
Well, and again, my situation is with Yemen. While I'm no fan of the Saudi situation and this Iran-Saudi proxy war that everyone's kind of running, there's no good people to work with here.
No, there's not.
Right? There's Saudis in this for themselves. The Yemen population, you have these guerrilla warlords. So I've heard stories of missionaries and different things where they go in, they try to land a plane, they move the supplies into the town. They either attack the convoy bringing the supplies, they attack the people in the town, they'll execute everyone in the town. I mean, it's just, it's literally just Mad Max.
Well, there's no white hats and black hats here.
Yeah, there are no white hats.
I never said that. I don't think we should be involved.
They're just making sure people, if they don't know much about Yemen, because we probably are way more connected to foreign affairs and covering some of these, because let's be honest, in the last how many years what foreign stories get attention? Only things that involve Orange Man bad narratives, North Korea, Iran, things that were short-lived in the grand scheme of things. But all the relationships with the Saudis, proxy war, drone use, these kinds of things, none of that's making the press anytime soon. And even then, most people didn't follow it under President Obama. We were in the minority of even knowing what most of that was going on. So I don't think I would doubt most people without looking can tell us where Yemen is on a map.
No, I'm sure of that.
Yeah. So now we have this people where it's just basically going to be a massive death toll if COVID just runs through the population because medical care is likely just non-existent, right? And forget about ages. Was this going to mess up global data at all? Just won't be that big of a blip.
No, I mean, looking at the 188 countries that have reported cases, Yemen it is a blip.
Yeah.
However, just that case fatality rate is enormous. It's higher than anything Italy ever had.
Oh yeah. No, we're talking more than double. More than double the worst of Italy. Not even like the peak of Italy got into the neighborhood of 12%. But that was short lived because that was the peak of their hospitals being overrun and all that. Obviously, those numbers have all become manageable now. I
suspect it's lower. It's actually lower than 27%.
Right. There's no testing. Yeah. There's no information, no data.
Just, I'll say Doctors Without Borders, they do a pretty exemplary job on this kind of stuff. These people are volunteers and they're going all over the world doing this kind of work, and they are not known for blowing a lot of hot air. They're pretty straightforward.
I would be shocked if you can prove that Doctors Without Borders are making up stats and data. And that's just not. I've never ever, even when the media was trying to paint them in poor lights over the years for whatever reason, it was all just garbage.
They're pretty on target. So
so a lot of T's and P's going up for the Yemeni population. This is a horrible thing, man. You're just trying to find some food. Next thing you know, you got a virus. You don't even know why. And
next thing, a bomb's coming down.
Just drones flying overhead, and it's just like
I mean, and this is really. I have some numbers here, but I think we're good now. But I mean, the way this is affecting children, UNICEF and World Vision, the Christian organization, they're all over there trying to do stuff to help out these kids. It's a sad situation.
Yeah, I don't even know what to do. There should almost be a way we can just. I don't want to take kids away from their family, but many of these kids are just going to be orphaned, and at some point you're just like, let's just relocate them and figure out a way to put them in a home and figure it out, because this is crazy.
It's not going to get better. I think they had a temporary ceasefire when the first case of COVID happened in Yemen.
Yeah.
And I don't know where that's at now. I haven't found out.
Wow. All right, folks. Well, tell me if you can find Yemen on a map. COVID. You aren't hearing this on CNN, I assure you that. News Talk. Outbreak News Today guy. Telling you, he knows what's going on. If you want to know what's really going on with COVID and what's going on with different outbreaks, infectious disease, he's the guy. Different things that we'll try to bring up from time to time here on News Talk. We appreciate your time. Hey, we're News Talk with Brandon and Bob. We're here to tell you about some of the facts so you don't have to waste your time watching CNN.
We don't want you wasting any time with CNN.
Or Fox or MSNBC or some of these other guys that are making a whole lot of money.
Et cetera, et cetera.
It's not paying.